Hello, I'd like to introduce you to Dr. Andrew Money-Kyrle. Andrew is one of the key speakers on the emergency cardiology course, where he talks about the use of pacemakers in emergencies. Andrew, perhaps you could tell us a little bit about yourself to start with.
Thank you, Jean. I'm a consultant in Buckinghamshire, working mostly at Stoke Mandeville and Wickham hospitals, but also I do interventional cardiology at the John Radcliffe Hospital in Oxford. And so that's really my subspecialty, but it's become very apparent recently over the last few years that temporary pacing in particular in our region is an issue for the junior doctors. So I've taken something of a lead in developing our temporary pacing training for the junior doctors.
So why do you think pacemakers, cardiac pacemakers, are important for the general emergency physician or emergency room doctor?
Well, I think you can never predict when you're going to be faced with somebody in a life-threatening situation because of bradycardia or or ventricular tachycardia or something like that that might require pacing. And because many hospitals in the United Kingdom don't have either consultant cardiology cover or even registrar cardiology cover, it's often necessary to have expertise amongst the general medical registrars and general medical consultants, as well as anaesthetists and so on. And it's very, very difficult to get enough experience of this because nowadays, because of the change of management, particularly of heart attacks, we find that people don't present so much with life-threatening bradycardias. So I think it's very important when people may be expected to deal with a life-threatening situation that they haven't really come across very often in their working practice. It's very important to give them the appropriate training and skills to manage that correctly.
Good, good. So what are you going to talk about in the lecture today?
Well, first of all, I'm going to talk about the indications for temporary pacing, and also to remind people that there are other strategies, such as pharmacological and so on, that they can adopt to try and stabilise the situation if somebody's in trouble. Once I've established the general indications, I go through techniques to safely pace somebody with a temporary pacing wire, either invasively via the femoral vein or the internal jugular vein, or I talk also about external pacing and other modalities of pacing. And it's really I adopt a interactive approach so that people have the opportunity to see a variety of different case scenarios that they can comment on and come to some conclusions. I talk about the guidelines for temporary pacing, both the American Heart Association ones and the European ones, and hopefully at the end of it people will have a clear idea of the indications, some ideas about how to safely put a temporary pacing wire in, and also how to set up the settings for the temporary pacing boxes, which I know a lot of people who are non-specialists find very difficult to get to grips with.
That sounds absolutely fascinating. I'm sure everyone's really going to enjoy that. Thank you very much, Andrew.
Thank you, Jean.